My name is Jessica Broughton. I have a Bachelor of Arts degree in psychology, and I'm currently working on my master's in education for special education. With psychology, because I have an interest in the mental health population, I feel like they're a misunderstood group of people, and I feel like I just have a passion to help people like that. I currently work for a psychiatrist in downtown Dayton at Midwest Clinical Research Center. I do drug research, phase 2, 3, and 4 trials for medication that's trying to get approved by the FDA. The process of getting a drug approved by the FDA is a very lengthy process. It first starts out in labs with research animals, in which a lot of times they use rats, beagles, and monkeys, and they inject the animals with their drug compound to see, is it safe? Is it going to kill the animal? They also test what is the lethal level that the drug's tested at, what will kill the animal. Beagles are tested because their brains are so much like ours, and that lets them look at the brains and what it's doing to them. And then level 1, which is inpatient research, is the next phase. And during level 1, that is where they ask for healthy volunteers that have nothing wrong with them to go into an inpatient setting in a hospital. Then phase 2, 3, 4, and 5 is what my company does, and phase 2, 3, 4 is where they're just doing research. They're trying to find out, we know it's a safe drug at that point, but what are the side effects of the drug, and does the drug work? We do various assessments on the patients as far as their vitals, EKGs, a ton of blood work. We monitor their weight, actually their waist circumference, to see if there's any side effects with the drug, and if there's anything bad, like does it make their blood pressure go up, can it cause people to gain weight. And then we're also looking at things like how depressed are they, with different scales that are already approved by, you know, the medical boards and the FDA and people like that. We do HAM-Ds, we do MADRS, we do all these different assessments that we do, blinded raters, we do them as coordinators, and then we also do patient assessments. All that information is compiled in a chart. Then we also enter all that information into a database system, and that's where the sponsors, meaning the drug companies, take that information, compile it, get the results that they want, and that's what's submitted to the FDA during phase 5, which is always open label, but during 2, 3, and 4 it can be open label, meaning most of the studies are double blind, so I don't know who's on drug, and they don't know if they're on drug or placebo, which is like a sugar pill. But during open label studies, there's been enough things done to show that it's safe, it's not going to cause any harm, so now they want to know, does it work? What's the efficacy of it? Does it work over a long period of time?